Okay. Little mix minus two. We want to cover tonight the supplement review of interferon alpha. We have been, over the past year, supplying our recipient, Dr. Muhammad's patients with IB100, which is the low-dose alpha interferon created by research biomedical scientist Victer Muhammad. Today, we'd like to give you our case studies concerning this supplement. We thought it was most important that we do give you this because it covers such a large range of illnesses, and what we found has been very effective for very many people. So tonight, we thank you for tuning in live. First of all, we'd like to apologize for our lateness. We had a couple of technical difficulties. However, we are here tonight with the supplement review of IB100 interferon, low-dose alpha interferon liquid created by biomedical scientist Victer Muhammad. So we'd like to get right into it. First, thank you, Dr. Muhammad and Mr. Victer Muhammad, for coming on tonight. Thank you for the time that you spent working and helping us to heal ourselves. And thank you for being here this evening. Would like to start with, let me unmute your phone, there you go. Start with Dr. Patrice Muhammad. Dr. Muhammad, can you tell us what you've been doing with the supplement over the last, since May, for the last 6 or 7 months, and the results that you've gotten with your patients that have been taking the supplement, the case studies that you want to present this evening?
Okay, sure. Thank you, Mr. Muhammad, Mr. Eric Muhammad. I would like to tell you about the excellent work that we have been doing by the grace of God, that our research biomedical scientist has provided us with an answer to the ills of many of our people who have not had any answers. And those answers, those prayers have been answered. It's unfortunate we don't have a windfall of people who are seeking what God has blessed him with. But after tonight and after subsequent other presentations, we will definitely solve that problem. So I have, since May, I have been consulting with patients and recommending the immunotherapy Immune Boost 100 for a wide range of conditions. I have 15 case studies that I'll be presenting, and I'm going to go through them very briefly, just with the significant information for each study. And we'd like to say that our research or our case studies are clinically significant. The majority of them are clinically significant. And when I mention clinically significant, I mean that there is a measurable test or measurable biochemistry that we can see to show that there has been improvement based upon this supplement. And I'll give you the information, and I will give you an example. Well, I'd like to start with my first abstract, which is a case involving a 29-year-old African-American female. She contacted Health at Its Best June of this year. She was diagnosed by her primary care provider with rheumatoid arthritis. The patient made the decision she didn't want to follow the normal course of treatment, which is all of the case studies that I have are from failed treatment of the medical society and patients wanting something more natural, or patients did not have any confidence and faith in the therapy that was recommended. And so again, they sought more natural means, alternative means to assist them. She contacted us to determine if the supplement would aid her in her joint pain and return back to normal joint function. The patient requested and was given the supplement Immune Boost 100. 1 month later, the patient reported significant generalized decreased joint pain and swelling and improved energy. We will continue to consult with the patient and record any activities and changes that she reports. So as I go through the case studies, I want there to be something understood so that we can go through these without me spending a lot of time with each case repeating the same statements. This is clinically significant in that there was some improvement of symptoms, and there also there was some improvement with function. So joint function and symptoms. Her symptoms improved, meaning she had diminished joint pain and she had increased function, movement of her hand joints in particular. Those were the primary joints she complained of. So understand, again, when they contact us, they want to know what we can do, and we have provided Immune Boost 100 for these patients. And definitely was clinically significant for this patient due to a diminishing of a painful symptoms of having rheumatoid arthritis, as well as she had increased movement and range of motion in her hand. The next patient is 61 years old, African-American female. She had come to us in September of this year, diagnosed again with rheumatoid arthritis. And this patient actually did receive conventional therapy. However, she was displeased with the side effects, and she wanted to know if Immune Boost 100 would help her. Well, she requested a trial. We gave her Immune Boost, and 1 month later, the patient reported significant generalized joint pain had decreased. She had joint swelling, which had totally gone away, and she had, again, improved energy, and we're still working with her. We're awaiting actual studies because she had an initial test that was done called SED rate, and it's called the ESR, which is an estimated sedimentation rate that was initially elevated. And she just recently, within 1 week's time, last week, had that test retaken, and I am awaiting those results. The next case study is a 64-year-old African-American female, contacted Health at Its Best in September, diagnosed by her primary care provider with rheumatoid arthritis and morbid obesity. She made the decision she wanted to see us. She did not want conventional therapy. She received the Immune Boost 100, and she reported that she had, she actually walks with a cane. And 1 month later, patient reported decrease in joint and back pain due to her morbid obesity with increased energy. and we will continue to consult with her and record any activities. One point I'd like to make now, when someone is ailing and has a medical condition, just across the board, there is a complaint of fatigue or weakness, no energy, lack of the ability to want to do something because you're ill, because you can't walk, because you're not as functional. So I like to point out that a symptom or if there is a statement of increased energy, that's significant, because anytime you can increase someone's energy and cause them to be more functional to want to do something, that is a step towards healing. That's a step towards them being able to get out, do more. They are more open to doing more things for their health, for family members. So that's extremely important when you have increased energy. And usually that's one of the very first symptoms that's letting us know, very first improvements that lets us know that this is working, because they're able to get up and do and want to do something besides sit on the couch or just lie around. My next case is 69-year-old African-American female, contacted us again in September, diagnosed with systemic lupus erythematosus, which is lupus. She actually was receiving methotrexate for her treatment. She had been off of methotrexate for several months prior to coming to Health at Its Best due to complaints of side effects of methotrexate. And so she wanted relief of her moderate to severe daily joint pain, stiffness, and swelling. She reported, in 2 weeks, in 14 days, the patient reported that she had awakened without any joint pain. And that was something that had not happened in quite some time, maybe the past year, I believe. She had no joint pain whatsoever. And she had generalized decreased joint pain, stiffness, and no swelling after 1 week of immune boost. And this patient was diagnosed 5 years ago. So within 5 years, she has not had an occurrence or incidence where she was able to wake up in the morning without any joint pain. That's clinically significant. The next case is a 59-year-old African-American male, contacted Health at Its Best in July. The patient was diagnosed with chronic headaches, uncontrolled high blood pressure, and benign prostatic hypertrophy and an enlarged prostate. He made the decision he wanted to try something because all the medicines were causing him to have headaches. He thought the medication actually was causing the headaches, and his blood pressure just was not controlled, regardless of what he took. There was no control of his blood pressure, and he just stopped taking everything. After 1 month, the patient reported he no longer had any headaches. And actually, after the first 5 to 7 days, after the first 5 to 7 doses of the supplement, there were no headaches. He also had a decrease in his blood pressure from 180 over 110 to 190 over 100. Now, we look at that top number, the systolic pressure was still elevated. He's not taking anything, but he's off and on. He's a little intermittent with some of the other supportive supplementation. But due to Immune Boost 100, we have a 30 millimeter of mercury decrease in his diastolic blood pressure, which is the lower number. So again, that's clinically significant. And he continues to take Immune Boost every day and is due for his follow-up, and we will have and record activities and changes in his record. I have a 70-year-old African-American male, contacted Health at its Best in September, diagnosed with type 2 diabetes, uncontrolled hypertension, and prostate cancer. He contacted us to determine if the supplement would help because he was not taking anything. He stopped taking anything. He stopped taking all the medications prescribed because he did not like the side effects and he did not think that they were working. Blood pressure was not dropping, blood sugar was not dropping. Patient 1 month later reports the blood pressure has gone down from 190 over 100 to 140 over 92, 140 over 92. The patient's fasting blood sugar has improved and has less nighttime urination. He has a decrease in getting up at night to go to the restroom, to go to the bathroom. The patient's baseline prostatic specific antigen is 50, which is markedly elevated. I will follow this number, but the baseline just 1 month ago was 50. The next case is a 49-year-old African-American male. Came to Health at its Best in October, diagnosed with type 2 diabetes, high blood pressure, chronic renal disease, and legal blindness. The patient came to us hoping that we could help restore his kidney function. They are recommending him for hemodialysis. And right now, his glomerular filtration rate, that's one of the renal tests that measure the need for dialysis. And he is now 12.8. In order for this to be normal, it needs to be a number of 15, but he's at 12.8 right now. And 1 month later, the patient reported overall improved sense of well-being and energy. And right now we're waiting for his most recent lab result to show the other benefit of Immune Boost. I have a 49-year-old African-American male who contacted us just this month, diagnosed with Bell's palsy, which is a nerve. He had a nerve infection. They think it's an infection. It's a virus they believe has a viral component because they treated him with antiviral therapy of Valtrex for 14 days and steroid therapy with prednisone for 14 days. At the conclusion of his treatment, the patient was still symptomatic with right-sided numbness and tingling and facial droop to his face. He contacted us and hoping that Immune Boost 100 would be able to help restore his nerve function back to normal, help with his facial droop and the tingling and pain that he was getting. And after 14 days, the patient reported complete closure of the right eye because there was facial droop. His eye, his mouth, his lip, his jaw was drooped, and the eye was open partially. It would not close due to the nerve being paralyzed. So after 14 days, he was able to close his right eye completely. And he was very happy with that he no longer needed to use eye drops to help keep his eye wet every day, all day. We will continue to consult with the patient and document any changes. I have a 57-year-old African-American male contacted Health at its Best June of 2019. He had complaints of joint pain and muscle wasting, but denies any particular diagnosis from his primary care provider. He contacted us because he said that he wanted to slow the joint pain and slow the further muscle wasting that he was starting to experience. So he had taken Immune Boost 100, and 1 month later, the patient reported reduced joint pain from moderate to only mild, and he had increased energy in his daily activities. The next patient is a 69-year-old African-American male, contacted Health at Its Best in June of 2019. He was diagnosed with high blood pressure, congestive heart failure, and type 2 diabetes. He began taking Immune Boost 100 to help improve. He wanted to help him improve his cardiac function and improve his exercise capacity. As of, actually, he was lost to follow up briefly, only within 1 day, yesterday, he was able to report that at the time of taking Immune Boost, that he noticed that the swelling had gone down. He noticed that, again, he had more energy. However, he does admit that there was a little bit of non-compliance on his part. And so we're due to follow up with him soon and get him back on track. I have a 48-year-old African-American male who contacted us in September, diagnosed with varicose veins, which were moderately painful, and low back pain. He began taking Immune Boost 100, and because he wanted us to aid him in decreasing the pain and preventing any further recurrence of varicose veins. 1 month later, the patient reported minimal pain of the varicose veins, improved back pain from moderate and frequent to only occasionally mild back pain. He also reported significant increase in energy, allowing him more productivity in his business. That's his words. I have a 49-year-old African-American male who contacted us in August, diagnosed with multiple myeloma, deep venous thrombosis of the right lower leg, and obstructive sleep apnea. He had undergone chemotherapy and was considered in remission, although his kappa light chains, which is one of the diagnostic tests that manages and monitors his activity, or the cellular activity of multiple myeloma. And his cellular activity, the kappa light chains had decreased from 97 to 48 within 45 days of starting Immune Boost. That's extremely clinically significant because it had taken a year, almost 1 year, to experience in just minimal decrease in his kappa light chains. And within 45 days, he received a decrease from 97 to 46. He also reported that he had increased hair growth on his scalp and well as all over his body. I don't know the significance of that, but he had hair growth. So we know it helps with hair growth, obviously. He also admits that he no longer, he reported he was sleeping through the night without awakening often due to his obstructive sleep apnea. That's one of the side effects of having that condition, is you awake frequently at night because you have difficulty in breathing. And he admitted he was sleeping through the night with no problem. Very clinically significant. I have a 45-year-old African-American female contacted Help at Its Best September 2019. Diagnosed by her primary care provider with HIV in 1997, hypertension and chronic renal disease since 2018. So last year she was diagnosed with chronic renal disease. She had been receiving a regimen. She had been receiving the intranasal alpha interferon low dose for approximately 6 years, intermittently from 1998 to 2000. Actually, that's 4 years, from 1998 to 2002 for HIV. She also received triple antiviral therapy for approximately 5 years, intermittently. She was non-compliant, so intermittently from 2004 until 2019. She inquired about the supplement because she did not like the side effects from the triple therapy, causing significant nausea and fatigue, and wanted to also take Immune Boost 100 for her chronic renal failure, because she also was being recommended for hemodialysis, and she did not want to go on dialysis. So 1 month later, the patient's glomerular filtration rate increased from 9 to 11, 2 points elevation in 1 month. That's not common at all. Possible slimly, but not common at all in the world of medical management. Usually when a patient has diminished renal function with a GFR of 9, that person is being prepared for hemodialysis, and there's no other discussion about it. There's no other discussion that we're going to follow you and course this along with other medications or any other therapies to return normal renal function. Not at all. That's not a discussion. But she has increased 2 points in 1 month. So we're now waiting for her next lab results, which I anticipate will, if you're going 2 points up, if we're following this, 2 points would be at 13, which is only 2 more points from normal glomerular filtration rate at 15, which will bring her out of the window of requiring hemodialysis. Her current T cell count is 221, and her what we call her viral load, her HIV PCR, is non-detectable right now. The patient's blood pressure was previously uncontrolled, and she was on antihypertensive medications. And her current reading off any medications besides the Immune Boost 100 and some other supplementals is 140/80. And we'll continue to follow that patient for any changes and updates. I have a 52-year-old African-American male that contacted us in July, diagnosed with type 2 diabetes, high blood pressure, chronic renal disease, and recently had a heart attack 1 month, less than 1 month prior to coming to my office. He decided that he wanted to lower his blood pressure as well as keep him from having a second heart attack, as well as keep him from having hemodialysis. The patient blood pressure in 1 month of taking Immune Boost 100 went from 176/113 to 150/100, and then 1 month later now being normal at 128/77. Blood sugar is uncontrolled at 210. And the glomerular filtration rate right now is 13. However, his most current lab, we're awaiting, and hopefully that'll be towards 15, so he would not be considered or not have the conversation with his renal specialist for hemodialysis, because he has been approached with that conversation. The next patient is 48-year-old African-American male, contacted us in June of this year. The patient was diagnosed with ALS, and this patient made a decision. He didn't want to have the conventional therapy. He wanted to have a more natural therapy, because the conventional therapy, the side effects that they told him of the therapy that was supposed to help him, which was an IV immunotherapy. It was an immunotherapy program, but it would have to be injected. And the side effects, he didn't want to incur those. So he started Immune Boost 100. Unfortunately, the patient, after a while, after having some benefit of some slight increased energy, his family members kind of, sometimes our family members can take you off course, and he decided that he would not continue to take anything. He's not taking the Immune Boost 100, nor is he taking any conventional therapy for his diagnosis. And I believe that concludes my presentations, my case studies.
Thank you very much for that presentation.
Yes, sir.
Victor, do you have any questions for Dr. Muhammad at this point in time, or any statements you'd like to make before we go forward with my clinical studies that I have to present?
No, not at this time.
Okay. So at this point in time, I would like to give our viewing audience my report of the people who have received Immuno Boost 100 through Nature's V. These are recipients that contacted Nature's V and decided that they wanted to see if the supplement could help them. We have been under this giving the supplement to our recipients for over the last year. We started last year, and I'll start with my first case study. This is an African-American female, 43 years old. She contacted us back in March of 2019. The female had been diagnosed by her neurologist with basilar arterial artery migraines, an autoimmune disorder that was very similar and diagnosed as myasthenia gravis, and seizures. She had this diagnosis for the last 12 years of her life. She had tried pharmaceuticals and other supplements to mitigate her illnesses and other naturopathic medicines. So she contacted Nature's V, and we recommended the supplement to her to see if she could, if it would give her any relief. The recipient reported that 3 days later, the relief from pain and increase in energy levels. 7 days later, the female reported relief from all of her stiff joints and a full return to her mobility and walking gait. We will continue to consult with the female and record her activity. She is currently still on the supplement. Our next recipient is a 72-year-old African-American male, came to us in August of 2018. He had been diagnosed with prostate cancer. His PSA was recorded at 32, enlarged prostate swelling. He also contacted Nature's V to determine if Immuno Boost 100 would be a good supplement for his condition. after the client received ImmunoBoost 100 and taken the prostate treatment for 60 days with other supplements, he reported that his PSA dropped down to 0.02, which is a significant drop in his PSA, almost unheard of. But this is what the recipient has reported to us. Our next recipient is a 57-year-old African-American female who contacted us in August. She was diagnosed with lupus. She requested the supplement from Nature's V, the ImmunoBoost 100. She took the supplement for approximately 3 days. She reported complete relief from her lupus condition. She was walking around. She had no more joint stiffness. Her migraines were gone. Really, her mobility returned. And at that time, she decided not to take any more of the supplement. She has since contacted us back to get back on the supplement because she, after 1 month, and being off of it for 3 months, she says some of the symptoms have returned. But like we tell everybody, just because you begin to feel better, it takes time for any viral malady to be taken out of your body. So just because you feel better doesn't mean it's no longer there. Our next case study, the recipient is a 58-year-old African-American female. She contacted us in July 2019. She had been diagnosed by her doctor with multiple myeloma. After a year and a half of diagnosis, pharmaceutical drug trials and radiation treatment, trial and error, she contacted Nature's V, and we recommended that this would aid her recovery. The client took the supplement for 1 month and began to report relief from her fatigue. She reported that all of her joint stiffness went away in her legs. She returned to her daily walking regimen. She was no longer taking any chemotherapy or any radiation medicine, and still to this day reports a good report in taking the ImmunoBoost 100 for her multiple myeloma. Our next case study is an 80-year-old African-American female with severe rheumatoid arthritis. She was basically confined to her electric chair, not doing anything around the house, just taking care of her husband and having conversations. She began to take the ImmunoBoost 100, and upon taking the ImmunoBoost 100, within 2 days, it was reported that she was back up. She did not have any pain. She was moving around the house, getting back to her chores, and very active. This is the report that she reported about her relief from her rheumatoid arthritis on ImmunoBoost 100. Our next recipient is a 40-year-old African-American female who has lupus, who was completely immobile, could not move, walking with a cane, did not have the ability to take care of her family and others. She reported that after a week of taking the supplement, that she had relief from her pain. She was able to move around. She's continually on the supplement now, and now she's back to having her life back. She no longer has the migraines. She no longer has the joint pain, and this is what she has reported to us here at Nature's V by taking the ImmunoBoost 100. Our next recipient is a 71-year-old African-American male. He contacted us on June 6, 2018. He had been diagnosed by his doctor 27 years ago with HIV, HSV1 and 2, type 1 diabetes, an enlarged prostate, hemorrhoids, low red blood cell count, and neuropathy, and a compromised immune system. After 20 years of pharmaceutical treatment, he contacted Nature's V, and decided that he wanted to take something more natural due to the side effects that were occurring due to the cocktails that he had been taking. He now reports relief from. He currently has no HSV 1 or 2 outbreaks and has not had any since he started taking the ImmunoBoost 100. For those who don't know, HSV 1 or 2 is herpes. He had his diabetes is no longer present. His prostate swelling has reduced to where he doesn't get up at night and he doesn't have any pain in the prostate. His neuropathy is gone, and he has not taken any antiviral for his HIV since June of 2018. Any antivirals. He's just been on ImmunoBoost 100 as the supplement for his HIV. He will be going next week. We'll be giving you a report in January to give us his antiviral count and his antibody count as it relates to HIV. And that's that case study. We also have a 61-year-old African-American female who had rheumatoid arthritis. The patient didn't want to go to normal route of treatment. She didn't want to take all of the painkillers and things of that nature. She's taking the supplement currently, and she's reporting that all her joint pain and swelling has now gone away. She's moving around normally and has returned to a very, very normal life as regard to her normal daily functions. The next recipient is a 82-year-old African-American male. He contacted us in September of 2019. He had been diagnosed with severe large plaque psoriasis. He contacted us and asked for ImmunoBoost 100. 2 weeks later, he reported complete clearing of his psoriasis off of the large plaque psoriasis off of his arm and his chest and his body. And to this day, from taking ImmunoBoost 100, he says that it's continually clearing up. That's all of the case studies that I have to report at this time. And now we'd like to give way to Victer Muhammad, who is the biomedical scientist, research scientist, who is the creator of IB100, a low-dose alpha interferon. He's also been a biomedical scientist for almost 40 years, working at Johns Hopkins and NIH and at the Howard University Breast Cancer Research Center. So I'd like to introduce to everybody today, Mr. Victer Muhammad.
Good afternoon. The reports that you've just finished listening to were compiled from basically the last year. There are others that Dr. Muhammad and Mr. Muhammad did not mention. These are people who have contacted me, and rather than go through them case by case, I will say that there may have been 20 people with whom I've dealt with directly, and their situations are a culmination of the examples that you've just heard. And this, the use of this product, this particular product, goes back to 1994. And from November 1994 to August 2002, there were 5 clinics around the country who employed the use of this supplement. And by August 2002, there were 8 AIDS patients, people who had been diagnosed by their primary care physician, who by August 2002 had been found to be, their viral load was rated by LabCorp non-detectable. Now, to review this data, we asked the clinicians to have the patient sign a release so that we, a team of about maybe 6 people, could go into the clinic, and with the release from the patients, we were able to review their case files. And we saw the diagnosis where the patients in those clinics had been diagnosed with HIV and the first viral load and CD4 count. And this was by LabCorp. And then we saw their LabCorp results from when they were found to be non-detectable. And in all 8 cases, the patient's viral load, these were not my patients now, because I'm not a clinician, but we were given permission by the patients to review their case files in the clinic. And in each of the 8 cases, the patient's viral load by LabCorp was rated non-detectable. We did not say that they were cured, but the viral load was non-detectable. And so maybe some people will argue that it's a case of semantics, but you know, we will leave it there and just say that that the patients were non-detectable. There were other patients in different clinics around the country under the tutelage and auspices of their primary care physician who used the supplement in the 1990s and early 2000s for things like lupus, hairy cell leukemia, herpes, and some of the cancers like fibroid cyst and ovarian cyst. Some will argue that that's not cancer. Well, again, semantics. But it helped in reducing and in some cases eliminating those fibroid and ovarian cysts that prevented the woman from possibly having to consider removal of the ovaries or removal of the fallopian tubes, the uterus. So I won't go any further than that because we don't want to tax you. We don't want to unnecessarily tax you and your attention. But that's a summation of the reports that we have at this point. And in the very near future, we will bring forth more cases and we'll go deeper in detail because we have had some occurrences that caused us to have to go and review some of the cases that were not normal. But rather than go into them now, we will do that in the future because it called on me to have to go back to my literature and my textbooks to try and figure out what had happened. But we think we were able to deduce and analyze the problems, but we'll report that later. So at this point, that's all that we want to give at this point. And I'll turn it back over to the producer, Mr. Eric Muhammad.
We'd like to thank our listening audience for tuning in. And it's very important that you get an alternative view of health. And we here at Life Sciences of Washington with Mr. Victer Muhammad, Health at its Best with Dr. Muhammad, and myself and Nature's V, where you can get the supplement from, we intend to present a case for a new health paradigm, which we're being guided to by Mr. Victer Muhammad. I would ask him to give us a short synopsis of that since we have a listening and viewing audience today, if he doesn't mind. And so you will know what we intend with this new health paradigm.
Thank you. I'll give a snippet of what we're going to do because there are certain protections that we need to have in place before going into detail. But basically, The Bible says that, behold, I make all things new. And if God is going to make all things new, then that must mean that he's dissatisfied with the current status of whatever it is that he's going to make new. And if we are honest with ourselves, medicine, Western medicine does have some benefits. We cannot deny that. But the number of consequences, I think, far outweigh the benefit. And I don't think that there's a problem with people having options. Otherwise, that's called a monopoly. And I'm not saying that Western medicine is a monopoly, but what we have been given and what we are introducing to this country and the world is a new healthcare system, a new system of taking care of your health. And that does not include any medications. It doesn't include drugs. We will not use drugs. We will not use medication. And we will we will consult with people regarding their biological health, meaning cold, flu, AIDS, hypertension. These are called biological ailments. We will consult with people regarding their mental health, because the number of people suffering from mental health in America is alarming. And we have about maybe 25 years of experience in dealing with and helping people recover from mental problems. The third form of health that we will be providing is social. People are suffering today from social problems, social ills. And we have been given about 31 years of training in helping people to deal with social problems. And in the future, once we get our certain documentations in place and our protections in place, we will go into detail about these different types of treatments and how we will do these treatments. So at this point, that's what we'll give for now. But yeah, that's what we'll give for now. So, Mr. Muhammad.
Thank you very much to our viewing audience. Those who would like to get in contact with Dr. Muhammad, I will let her give you her contact information.
Yes, you can reach me at healthatitsbest1@gmail.com. The phone number to Health at Its Best is 773 area code 234-3319. Or you can also go to healthatitsbest.net, which is our website.
And for those of you who would like to consult with with biomedical scientist Victer Muhammad, he can be reached at Nature's B, that's NATURES-V.com, and you can set up a consultation with him there. Thank everybody for tuning in today, and we hope we've given you an alternative to a better health. Thank you, Dr. Muhammad, for being with us today. And thank you, Mr. Victer Muhammad, for being with us today and sharing your information. My name is Eric Muhammad, and we've had a pleasure being with you today, and please tune in to us next time. Thank you very much.
Thank you.